would want another certification. You know, this is, as of right now, this is a voluntary thing. You're not required to do it. However, there are definitely a few reasons to do it. If you have the desire to work with acutely ill or critically ill patients, especially if you're primary care trained and already working with acute and critically ill patients. And the reason for that is that the laws are changing. Certain states and organizations are kind of gradually falling in line with the APRN consensus model. And what it does is requires APRNs who practice with acute care populations. They have to be certified in acute care, trained and certified. So this is something that's coming down the line. I don't know when West Virginia will follow these guidelines. However, I think it's definitely coming. States like New York have already implemented these laws. And then lastly, you become more marketable. If you truly want to work in, you know, acute care, critical care as a hospitalist or even an ED provider, when you have that acute care certification with your credentials, you definitely become more marketable. So just a little bit of the program overview. Again, it is a postgraduate certificate. It's between 16 and 21 credit hours, and that varies depending on how many clinical hours you're required. Most students will be required to complete the full 500 clinical hours. We'll get a little bit more into that here in a few minutes. You can complete this program in 2 to 4 terms. So I actually have a student, Andrew, who's already joined us. He's completed the program in 2 terms, fall and spring, and he's done. I have another student right now who's spreading her program out over 4 terms because she's actually a brand new FNP, and she's kind of gradually adjusting to being a nurse practitioner as well as continuing her education. So she's decided to take the full 4 terms to complete clinical hours. And then upon completion of the program, you'll be eligible to sit for your certification in adult gerontology acute care. Faculty, Jody Gord, that's me. I'm the program director, track coordinator. And then we also recently hired Brady Bayowitz. I hope I'm not butchering your last name, Brady. I don't think I've ever had to pronounce it before. Brady has come on as a lecturer, and he also does serves as a preceptor for some of our students. And I see Brady's actually joined us.
So, hello, everyone.
Hi. A little rundown of the curriculum. You'll have 11 hours of online asynchronous coursework. In the first term, you'll take Nursing 758, which is Acute Care 1, and this is a 5-hour course. And then you'll also be required to take a professional role development course specific to acute care, and this is just a 1-hour course. In the second term, the spring, you'll take Acute Care 2, which is again a 5-hour course. And then looking at the practicum hours, this is Nursing 757, and it's a 10 credit hour course, but again, you can spread it out over 1, 2, or 3 semesters. The only stipulation to that is that you have to have completed 250 hours by the end of the summer term. So if you start in the fall, then you have the spring and summer. By the end of that summer, you have to have 250 hours. Just a little bit about the Acute Care 1 and 2. These are really kind of nuts and bolts classes. And when I say that, there's no fluff. It's all about presentation, workup, differential diagnosis, and then management. So it's really gets down into the basics of acute care for the nurse practitioner. It's set up in modules. There's 4 modules and 4 exams for each class, and then you will have some discussion posts as well. The Acute Care Professional Role Development course, again, is just a 1-hour course, and this goes over some things, again, specific to acute care and kind of helps you transition into that acute care role from a primary care role. Again, this is just the progression plan again. just in a chart form. And again, you can see where the spring, summer, and fall courses for your acute care practicum, the spring and fall are optional. So getting a little bit more into the clinical commitment, again, it's 250 to 500 hours, and the final requirement will be dependent on an individual gap analysis. Your preceptor can be an acute care certified nurse practitioner, or you can have a physician, MD or DO, that works as like a hospitalist, an intensivist, an inpatient specialist, or an emergency room. Unfortunately, we cannot use family nurse practitioners who are serving as hospitalists or in acute care, because again, this is an acute care program. Even if they've been a hospitalist for 20 years, unfortunately, they will not, they can't be preceptors. Whoops. So what you want to know about cost, as far as tuition and fees for the university, whether you're a resident of West Virginia or non-resident, in the first term, you'll have 6 didactic hours, and credits are $715 each. So 6 credits comes out to about $42.90. In the second term, say you do a didactic course and want to do just 1 clinical hour of practicum. Again, the same cost, 6 credits. And then in your third term, again, this is just a hypothetical. Say you do all 9 clinical hours remaining, and your cost is about $64.35. So your total for tuition and fees is right around $15,000. Other fees, you do have to have a laptop or tablet, nothing fancy. You can use what you have now. We have a program, a software program that we use called Typhon, and this is where you will log clinical hours and cases. It has a one-time fee of $100. You will be required to do go through a program called PreCheck, where you have a background check. We check to make sure your immunizations are up to date and things like that. Again, that's a one-time fee of $137. You do have to have basic life support and advanced cardiac life support prior to starting clinicals. Most people can get these through their employer for free, but if you're paying out of pocket, that's around $250. Your books, the books right now that we use, some may be available online through the WVU Health Sciences Library. If you purchase them, like, hard copies, it's around $300. I'm currently actually working with the library to try to get all of our books available online so that the digital copies are available to students. And then lastly, I wanted to mention a program called My Clinical Exchange. If you are doing your clinical hours with WVU Medicine hospitals, for instance, Ruby Memorial there in Morgantown, they do have a program that they use that costs $40. Again, it's a one-time fee. So overall, your additional fees are less than $2,000, and your total to complete the program is right around $17,000, which isn't bad compared to other places. In terms of a time commitment, your clinical time, again, is 500 hours. You spread it over 1 to 3 semesters. So say you do them in your hours in the spring and summer, you can average about 17 hours per week and get them done. Class time, again, 1 clock hour per credit hour per week. So you're going to have between 5 and 6 hours that you can expect to be watching lectures, listening to lectures and things like that, actually in the classroom. And then other things, reading, writing, study time outside of class. If the content is new to you, you can expect to spend about 3 clock hours per credit hour. However, a lot of the material that we cover, if you're working in acute care, is going to be, I won't say review, but it's going to be things that you already know about. And I think that's helped out a lot with the students that we currently have. They already have a strong foundation in acute care because most of them are already practicing. So we kind of dive deeper into evidence-based practice and cover some content that you may not be familiar with. So your total, again, around 18 to 40 hours a week, but again, it may actually be less than that if you're, if you're familiar with the content being covered. Admission criteria: you must have a master's degree from a nationally accredited nursing program. You have to have a minimum MSN cumulative GPA of 3.0 on a 4-point scale. You have to have an active unrestricted RN license in the state where you plan to complete your clinical hours. You do have to hold current national nurse practitioner certification for advanced practice in either family, gerontology, or adult primary care. And then lastly, you have to have evidence of completion of standalone graduate level courses, in advanced pathophys, advanced pharmacotherapeutics, and advanced physical assessment. A little bit more about the gap analysis. If you want to have previous MSN or DNP level practicum hours considered for credit, you have to submit a portfolio that includes a couple of items. The specific prior academic practice site information and the number of hours at each site, a description of prior academic practice experience and procedures performed, and a letter from your program director or associate dean of the previous graduate level primary care nurse practitioner program that verifies the clinical hours and sites that you are submitting. In addition to that, these hours have to be faculty supervised. So depending on where you, particularly your DNP, a lot of programs do not require faculty supervision as you complete your practicum hours. However, if you want them to be considered for gap analysis, they do have to be faculty supervised. As far as the admission process, applications are open now. They close July 1st. You'll be screened for completion, for the application completion, and then you'll be notified of your admission probably in the first week of July. And then classes start Wednesday, August 18th. If you have any questions, I put the link here to the online overview of the program, and then my email first, and also Philip's email as well. He's our recruiter. So that's all in terms of kind of an overview. I would like to get some input from Brady, if he's available, to kind of just give you a idea of what so Brady works in the CVICU at Ruby, and he's serving as one of our preceptors. So I'd kind of like him to give you an idea of what you can expect in your practicum, and some of the things that, procedures, patients, things like that, that you'll see in your practicum, just kind of from a preceptor perspective.
Sure. Good evening, everyone. I'm excited to have you all interested in the program and on board. So basically what we try to work with is that we understand that you've been an RN for some period of time, and you also have been an MSN or beyond, potentially as a nurse practitioner with a different certification. And our goal is to use your foundation of knowledge that you already have and kind of close the gap, and bring you to a focus of the acute care setting. So one of the examples I commonly use is, say, as a family nurse practitioner, you may be used to managing somebody in chronic heart failure on the outpatient side who comes in for their however annual of a visit. But on our side is managing the acute exacerbation of heart failure that requires admission, maybe not only to the hospital, but to the ICU, extreme fluid management, pressor therapy, inotropic support, that kind of a deal. So what we really work with also is that if you are an FNP who has been working in an acute care setting and you're simply going back to maintain this, to obtain the certification, is to just really help hone those skills and utilize your current practice with some additional techniques And then also, as always, to meet the needs of the coursework and then to prepare you for the exam as well. So in our ICU, with the students that we have, the longer you're with us, we work to have you put in arterial lines, central lines. On the occasion that we do get a chest tube, we at least have you help us facilitate the process. We're working on a transition in practice now as far as who's responsible for the intubations. But I do believe over the next year or two, as that falls more into the hands of the APRNs, that if you're with us as a student, that there might be the opportunity in a controlled setting, you'd have the chance to intubate somebody as well. But we're a high acuity ICU within ourselves. As the program expands, we should have more options to see the realms outside of the cardiovascular ICU into our medical, our surgical, our trauma, and different aspects like that. But really just kind of kicking things to the next level, bringing it back to the acute care focus.
All right, thanks, Brady. We really appreciate it. Again, Brady is at WVU Medicine at Ruby Memorial in Morgantown. Next up, I actually have our student, Andrew Novak, who just recently graduated after 2 terms. And he's going to give you just kind of an overview from the student perspective, what to expect as a student in this program.
Yeah, so overall, as Dr. Gord was saying, I finished a few weeks ago after 2 semesters, and I was, lucky to be in a situation that allowed me to do that. Used at WVU back in 2016 as a family nurse practitioner, and quite frankly, I was lucky to get a job in that position with my existing certification that I had. But even having said that, I always knew that I wanted to go back and get my acute care certificate. However, at the time, and really up till last year, there was no option within the state of West Virginia to get an acute care certificate or degree. And so certainly I jumped at the option to do that last year, as I wanted to kind of expand not only my knowledge base, but help with, for instance, recently we've had some staffing changes in the ICU where I work. And because of that, we're having to look at possibly moving ourselves to other ICUs. And while the existing ICU that I worked at, the neuro ICU, was initially okay with us being family nurse practitioners, some of the other ICUs, like the ones that Brady works in, the CVICU, they require you to be an acute care nurse practitioner to work there. And even some of the other ICUs, like the surgical and trauma ICUs at Ruby, they also require you to be acute care certified within the first 5 years from your start date there. So kind of, I could see that the writing was on the wall, that while it was, maybe okay at one time to regardless of your certification, to work in these areas, it's increasingly your employers are requiring that you have the appropriate certification, so you're best suited to take care of those particular types of patients. We all lived through COVID last year, and even up till now, we know how competitive the job market got when a lot of these hospitals put on hiring freezes. It was quite difficult to get jobs anywhere in the country, and even in West Virginia here. And so I bring that up just to say that, having these appropriate certifications makes it where you're a more competitive candidate. And, if you're going into a job that there's multiple candidates for that particular position, certainly it's going to benefit you to be able to say, in that interview or on your resume that, yes, I was a family nurse practitioner or primary care trained, but I did go back and I got the training that's going to lead me to success in this particular position. And so I think that you'll never be sorry, certainly, that you took the time to go back and complete this line of material. Another thing I wanted to bring up, and she kind of touched base on the tuition for the school, as before I even knew that WVU was going to have a program like this, I looked at quite a few different programs, and some of them were pretty competitive. Others were quite a bit more affordable, or I'm sorry, more expensive than WVU. So I think their tuition rates are quite competitive and affordable to begin with. But for those of you that work at WVU Hospital or another hospital that offers tuition assistance, certainly you should look into that. For instance, in my case, the tuition assistance program covered all the tuition. It didn't cover the fees, and it didn't cover the books. But all said, I would say it covered probably about 75% of the costs. And so if you take the numbers that she showed you there a few minutes ago, and you take only 25% of that cost, it kind of makes it a no-brainer. And so just make sure that, especially for those of you that are on the fence about it, to make sure that you look into those programs. It makes it quite financially affordable for most people to move on. And the fact of the matter is, you're never going to be able to get additional certification or a different degree for much cheaper than that. And so I was certainly glad that I was able to take advantage of that. Academically, and again, Dr. Gord kind of touched on this, it kind of depends on your background, how much you should expect to be able to, or have to put into study and prepare yourself for the exams. Working in the ICU, I felt like I had a pretty good foundation. When you actually get into the classes, you see that it does fill in a lot of gaps that maybe you thought you knew a little bit about, but certainly expands on that knowledge base. But I felt that the classes themselves, with the lectures being largely asynchronous, it allowed me to be able to work on the days I had to work. And then on my days off, I was able to put in a lot of time and study that material. So I was prepared for the exams and the assignments. And so it really makes it where it kind of caters to, whatever your schedule is with kids, with your job, et cetera, that everybody deals with. And it made it to where it was, pretty convenient to be able to be prepared. The clinical portion of the certification course, I was pretty lucky in that I worked in the ICU, and I knew other people that worked in our ICU. So I was able to do some pretty long shifts that allowed me to get a lot of hours done fairly quickly. And so if you're able to do that, especially if you have gap analysis hours that you can apply to it, you can get this done pretty quickly. I was able to finish all my clinical and be done with that in one semester, which made this only a 2-semester certification for me. But even for those of you that don't have that ability, or rather maybe you work Monday through Friday and you're only able to get clinical days on the weekends, you're still able to go for that in the summer and even the fall if you need to. And the great thing with how they set this up is that everybody's credit hours are about the same, right? So 1 credit hour is equal to about 50 clinical hours. So you have about 10 clinical hours, assuming you don't have a lot of gap analysis hours. And so basically, regardless if it takes you 1 semester or 3 semesters, your tuition rate will be the same. And so I really like seeing that even if I was unable to finish the hours in that 2nd semester, that I could have planned and set things up to go in the summer and not taking a huge hit for that. So I think they set it up pretty well. I was very impressed with how few issues there were with this being a new program last fall. I think a few of us were concerned that maybe there'd be a lot of bumps in the road with this, but I was very impressed that really wasn't the case. And I think those of you that are considering going on the 2nd or 3rd cohort, you're going to see it work even smoother now that we've learned some things. And certainly I put my input out there too, is ways to make this program better. So I think for me, it was a no-brainer. It was my understanding in some of the email correspondence that Dr. Gordon and I had, that there were still a few spots available for next fall. So I really encourage you guys to consider applying and apply early so you can secure yourself a spot in there. Certainly when you get to your clinical portion, I'll just put this out there now that I'm more than happy to precept any of you in the neuro ICU if that's something that you're interested in, or something you just want to get some experience and exposure to. There's a few of us there that are more happy to have you. And Brady, that's on here tonight, he actually precepted me a few days down in the CVICU. He's very knowledgeable himself, and him and a lot of his colleagues taught me a lot down there that I just really didn't know before doing this program. So it was just, I really don't have anything bad to say about it. It was very well done. And like I said, I don't mean to repeat myself, but I don't think any of you would be sorry that you enrolled in this and gave it a try. It'll be a very good experience for you. And it's for most people, I think that it's the ability to work your schedule around it is not going to be as hard as, say, your first graduate program. So like I said, I've kind of wrapped it up. I don't think I missed anything.
Thanks, Andrew. We
Yep.
really appreciate it.
Yeah.
And again, I appreciate the compliment. I felt like there were a few bumps in the road, but if you didn't feel that way, that's great.
Well, being a first cohort, you never know how it's going to work until, you actually get out there. And overall, I thought it was very well done. And one thing I did want to bring up is that I particularly appreciated how you guys got great instructors. One of my supervising physicians, for instance, did a lot of the neurologic teaching in the program. And we had other physicians from the Charleston area, ED docs, that did a lot of the emergency medicine talks. And so they really got really good instructors for these lectures, and that was something I certainly took a ton of notes, and I plan on using it just in my practice now. And it really was well done.
All right. Well, again, thank you so much for giving that perspective. We do appreciate it. And at that, I think I'm going to turn things back over to Philip, unless Dr. Rogers has anything to add.
No, I don't. It was very thorough. I'm curious to see if anybody has any questions.
Yep. As Dr. Rogers mentioned, we'll see if anybody happens to have any questions. We'll go ahead and open the floor if anybody does happen to have any. Well, if there are no questions, then you have Dr. Gord showed you my contact information. She showed her contact information as well. Please feel free to reach out to any of us if you happen to have any questions in the future. We are very happy to help out. Again, I do apologize for the technical difficulties when we first got started. My internet is up and working right now. So, but we appreciate you joining us this evening, and we look forward to working with you in the future. Have a good evening.